Hi there, I'm Dr. Michael Gambello, and I serve as the Section Chief of the Division of Medical Genetics at Emory University. Today we're discussing Fragile X premutations, a genetic concept that may be important for you to understand, especially if you're planning a family or have certain health concerns. Fragile X premutation refers to a specific genetic pattern in the FMR1 gene, which is associated with Fragile X syndrome. This gene contains a section with repeated DNA sequences. Think of them as a pattern that repeats itself over and over. In most people, this pattern repeats around 5 to 44 times, which is in the normal range. A Fragile X premutation occurs when someone has between 55 and 200 repeats of this pattern. It is called a premutation because it contains more repeats than normal, but not enough to cause Fragile X syndrome directly. What makes premutations unique is that they can be unstable when passed from parent to child, specifically when passed from a mother to her children. During this transmission, these repeats can expand or increase in number, potentially reaching the full mutation range of over 200 repeats, which causes Fragile X syndrome. Fragile X syndrome is the most common inherited cause of intellectual disability and autism spectrum disorder. When someone has a full mutation of 200 or more repeats, the FMR1 gene is unable to produce an important protein needed for brain development. It's important to know that being a premutation carrier can have health implications beyond reproductive risks. Women with premutations have an increased risk of ovarian insufficiency, which can affect fertility. Both men and women with premutations may be at risk for conditions which affect movement and cognition later in life. Fragile X carrier screening is recommended for women planning a pregnancy, especially those with a family history of intellectual disability, autism, difficulty getting pregnant at a younger age, or movement cognition issues at a later age. Understanding your Fragile X carrier status provides valuable information for family planning and your own health management. If you're found to have a premutation, a genetic counselor can help explain what this means for you and discuss your options. For more information about Fragile X testing or to speak with a genetic counselor, visit jscreen.org.